Hi, welcome to the Spine MDT. This video is about sacroiliac joint pain, quite a common cause of lower back pain, particularly at the base of the lower back. Often it can mimic slip disc and other causes of back pain. So it's important to get an assessment from your practitioner rather than self-diagnose it. So let's dive into it. Well, firstly, what is the sacroiliac joint? It's the joint between the pelvic girdle, and the sacrum of the spine, the lowest point of the spine. And this joint is essentially a load attenuator, a kind of shock absorber, if you like, between the legs and the spine. There's not much movement in this joint, just a little bit of a give before forward and backward rotation of the pelvis. Imbalances in load can cause wear and tear of this joint, which can cause pain. Bad posture from the type of work we do, sitting in office chairs long hours a day, equally can cause wear and tear of the joint. Excessive bending and lifting, bad posture overall. If you look at the skin of the lower back, the sacroiliac joint is usually marked by these two dimples you see in the lower back area. So any pain in this region or tenderness when you press on that area could be a result of dysfunction or degeneration, wear and tear of the sacroiliac joint. So pain in that area can also radiate down into the buttock or down to the back of the thigh, but rarely beyond that. Also, it can radiate round to the groin and mimic hip pain. That's why it's really important to have a good clinical examination by quite an experienced practitioner or doctor to try and clarify which is causing the pain. Whilst the diagnosis is usually clinical, an MRI scan can show you wear and tear along this joint line here or here on the opposite side, which can be useful to differentiate it between other causes of back pain. But it's not unusual to have a normal MRI scan despite pain coming from the sacroiliac joint or sacroiliac joint dysfunction with a normal scan. The good news about treatment, it mostly responds to fairly conservative measures such as physiotherapy. Here's the booklet from the British Association of Spine Surgeons. There's a link below. That gives you a bit more detail, but these are some of the exercises recommended that can help with the joint. So hamstring stretch, where you lie flat on your back in a doorway. You put one leg through the doorway and the other leg resting against the wall here, and you try and hold that for about 30 seconds or so, and then repeat that with each leg about 3 times. Stretching the quadricep, so stand next to a wall to support yourself, bend the knee and hold the ankle back with your hand, and again hold that for a few seconds, about 30 seconds or so, and repeat on each side. Then there's the abductor hip stretch, where you just lie down with the knees bent, ankles together or heels together, and then allow the knees to drop outwards and try and stretch them outwards. Again, do a few reps of that, holding the stretch for a few seconds. Another one is using either a ball or a cushion between the knees, and then compressing them with your knees. And there's more exercises here that are more detail in the actual booklet itself. If you enjoy working out, or if the pain has subsided slightly with the earlier exercises just shown, and you want to try something with a bit more resistance, I highly recommend following SacroIliac, who actually has got an excellent video here on sacroiliac joint pain and some more exercises you can do to improve it. The link is down below. If you're struggling to do these exercises to improve the pain, or doing the exercise actually makes the pain worse, then there is the option of an injection into the joint of a steroid that can give you a few weeks of alleviation, and it often does in the majority of patients. It's not a cure, so it's important you use that time of having better pain control to then do the exercises to try and keep the pain away. If the pain does recur, then the pain specialist can follow up that treatment with radiofrequency denervation, where again a needle is placed in and around the joint under some light sedation, and passing a special radiofrequency, a type of electric current, you can burn the nerve endings around the joint to stop the messages of pain reaching the brain. It's not permanent, but it gives you a longer lasting effect than the injection. And again, it's not a cure. So in that time, that's when it's important to start ramping up the exercises to keep the pain at bay, prevent it coming back. Now, when you read about this online, particularly surgery about this joint, you have to be very cautious in how you interpret that. The studies often have been done by a single surgeon or a single institution, so they don't give you a broader picture like a multi-center study would do of thousands of operations where you can see the results of it in comparison to other treatments. It's very controversial. I personally think surgery gives very poor results for sacroiliac joint dysfunction. And in my practice, by following the sort of algorithm I've just shown of the exercises by physiotherapists, injections or radiofrequency, and working as a team with all of these individuals, all of the patients I've seen have managed to avoid surgery. If you found this video helpful, please subscribe to the channel for more videos on the different procedures we do and the different conditions of the spine, and to keep up to date with upcoming videos of useful information about spine health, looking after your back and treating any problems you may have. The goal of the spine MDT is to find the least invasive solution that also gives you the longest lasting result. We're able to do this by working with a team of physiotherapists, osteopaths, pain specialists and surgeons in one network. Please check out our website, call us or email us, and we'll be very happy to help you. Thank you.